We have a very complex healthcare system in the United States. There are many different payers, private payers, governmental payers, and many different providers of healthcare. We have hospitals, doctors, pharmacies, skilled nursing facilities, home healthcare agencies, a number of manufacturers of drugs and devices. It is a very complex system. In this video, we are going to talk about insurance and paying for healthcare. There are a number of different kinds of insurance. Car insurance, house insurance, health insurance. Why do we have insurance in the first place? There are really three main reasons to have insurance. The first is to protect people against large financial losses, large random losses. If someone had a heart attack or got hit by a bus, it will cost them a lot of money to recover. Most families cannot afford to pay such big amounts out of their pocket just like that in an unexpected moment. And so, to protect against that, insurance comes in. You pay a small amount every month or every year for the large payout if something bad happens. So, one purpose of insurance is to protect against large financial losses. A second purpose of insurance is to reduce the barrier of using services for people. If you have to pay to go to the doctor, pay to fill a prescription, pay to get a particular test, you might think too much and you might not do those things. You might not take your medicine. You might not get a screening to prevent you from getting cancer. Insurance pays for those healthcare services, reducing the financial barrier to actually getting the necessary healthcare. And the third goal of health insurance is to pool risk. For any individual person, it's uncertain whether they're going to get sick or not. A good analogy is to take a dice. If you roll a dice, who knows? You might get the 6. You might get 1. You might get a 3. Any single roll is very uncertain what it will come up. But if you roll a dice enough times, it will average out to 3.5 over time. That's because over a large number, the average holds. The same thing actually happens in healthcare. If you have a small number of people, the chance that some person will get sick is unpredictable and high. On the other hand, once you have a large number of people, it becomes very predictable how many people will get sick, how much healthcare services they will need. Pooling works by bringing large numbers of people together so that you can predict the use of healthcare services and make the health insurance amount needed much more predictable. These benefits of health insurance come with two problems. The first problem is called adverse selection. If you allow people to voluntarily decide whether they are going to buy insurance or not buy insurance, we know that people who are sick or who have a high likelihood of getting sick are more likely to buy health insurance. That has a problem. If only the sick buys insurance, then they increase the price. As they increase the price, then people who are less sick, but who were buying insurance, will stop buying insurance. And the remaining people who are buying insurance will be those who are very sick. This has what's called a death spiral effect. More people who are sick in an insurance plan increases the cost. The healthy stops buying. With only the sick, the prices go up, leading to a problem that no one can really afford the coverage. That is the problem of adverse selection. It's inherent in any voluntary system for buying health insurance. A second problem is called moral hazard. By providing people with insurance, you're actually reducing the price they see. If I go to the doctor and I need a test, insurance lowers the price of that test. The result is moral hazard. I tend to use more expensive tests and I tend to use more healthcare when I don't see the real price of the services, but I see at a lower price. Well, insurance companies have developed a lot of approaches to counteract the problem of moral hazard. The first one is obvious, the premium. They charge you a lot for the insurance. The second is a deductible. That is, you have to pay, say, the first $250 or $500 of your health bill before the insurance kicks in and covers the other parts. That deductible makes you cautious about using a lot of services. Similarly, every time you go to the doctor or every time you fill a prescription, there is a copay. That is a set amount that you pay for going to the doctor. Say $20 for a doctor visit or $5 to get a prescription filled. That is a copay each time you use a service. Coinsurance is like copay, but it's a fixed percentage. So say you go into the hospital and you have a 20% coinsurance. You are responsible for the 20% of the hospital bill. Out-of-pocket expenses are all of those combined. They're the premium with the deductible, with the copay, and coinsurance. That's how much you need to spend out of pocket in total. With that introduction to health insurance, next we are going to look at how people get health coverage through private insurance and a variety of governmental programs.